The Australian Government announcing a new Living with COVID strategy. It included cutting the number of psychology sessions people were eligible for each year from 20 down to 10, which has resulted in some opprobrium, in particular from advocates. Joining me now for more on this is Shadow Health Minister Anne Ruston. Thanks for your time. I'll get to that in a moment. I do just want to start on, you've been looking a bit at the flood situation in South Australia. It seems a bit of a different one. It's floods that are sort of taking a long time to peak and hanging around for weeks. Is it making it harder for people to live with it so long, or does it mean there's more time for preparation?
Well, I think it's probably a little bit of both. Obviously, people have had time to prepare for it. The peak isn't here yet, and we understand that it's likely to last, if not weeks, possibly even months. There's a lot of water outside the window that I'm sitting here at the moment. But it's the most spectacular sight that you'll see in the river, probably the most spectacular sight any of us are going to see in our lifetime. So certainly encourage people to come up and have a look at it. But we also need to be mindful that there are a lot of people that are going to be severely impacted by this high river down this end. Not the catastrophic things that we saw in Lismore, I will absolutely concede, but this is going to be a long, drawn-out summer for many people in the Riverland.
It will be, and let's just hope the situation is as good as possible, but it's certainly inevitable that there's floods coming, and pretty significant ones. Let's return to our topic then. So the number of psychology sessions were doubled at the start of COVID. They're going to return to normal as of January 1. Does this make sense? I mean, we're through the worst of COVID. Quite a while since we've had the worst of COVID, that eventually this number goes back to the previous 10?
Well, one of the things that we know from research that's been done by the Australian Institute of Health and Welfare is that it's often some time after the crisis or the pandemic or the disaster that people most need support with their mental health. And we're still in a pandemic, we're still seeing cost of living pressures and the like very, very high. Right now, as you say, I'm sitting here in a flood zone. So I would absolutely be questioning the timing of reducing the level of mental health supports to Australians. And I think the government really needs to come clean with why it's made a decision at this time when we know that people are still very, very much in need of the supports that have been provided by these additional psychology sessions.
What's your proposal though? I mean, keep it forever, because the demand will probably be there. There's always a cost. So is this the sort of priority you think should be permanent, and then how do we pay for it?
Well, I think what we have to do is we have to base, our decisions on the circumstances that are before us at the time. I mean, Minister Butler made a comment yesterday that he was going to hold a forum sometime early in the new year to assess the need for this ongoing. Well, I'd say, why don't you hold your forum before you make the decision as to whether you're going to cut these particular sessions? And we know from their own independent report that right now is not the time to be doing this. They've suggested that if they continue these sessions, we should target them at the most vulnerable. I mean, I'm obviously all for making sure that we target and focus supports that we provide Australians to those that most need it. But, to make a decision and then say we're going to retrofit it sometimes.
Okay, there's a bit more within the COVID space that was announced yesterday. We're also getting some numbers on the aged care spike, so a spike in cases and deaths. Is this just the brutal reality of a COVID wave, that aged care residents are always going to be vulnerable?
Well, of course, aged care residents are going to be vulnerable. Older Australians are more vulnerable to COVID. But, through the pandemic, in the early stages of the pandemic, so many things were put in place to try and put extra protections in for older Australians. But what we've seen, particularly this year, is an extraordinary increase in the number of deaths in aged care as a result of COVID. And so we saw a winter preparedness plan get delivered halfway through winter. So I think the government has got some questions to answer about what it is doing, has done in the past, and what it intends to do into the future as waves of COVID go through, because older Australians, particularly those in residential aged care, are not able to just sort of say it's just the same as flu. It is a really serious health issue for those older Australians. And I'd like to see this government putting in place specific and dedicated measures to protect older Australians in aged care for subsequent waves of COVID, which we know we're going to get.
Patients will mostly, apart from the very vulnerable, have to get a referral to get a PCR test now. What are your thoughts on that? I mean, they have cost us nearly $3 billion, these tests, since COVID began.
Well, I mean, I think the confusion yesterday, the minister came out and said you'd have to get a referral to get a PCR test. And then we saw last night on the health department website, there was some clarification around that maybe you actually didn't. I think what we need to do is we need to make sure that the messaging that we're providing to Australians is simple, it's easy, it's consistent, because we're going to have to live with COVID going forward. And the mixed messaging that seems to be coming out and the change in directions. I mean, the COVID plan yesterday, before it was changed, lasted less than 24 hours. And I mean, we all accept that we are going to have to live with COVID, but the best thing governments can do is to be consistent, provide sensible and easy messaging for Australians so that they can find it easy to comply with the things that we need to do so we can keep ourselves safe, our families safe and our communities safe going forward.
Shadow Health Minister Anne Ruston, thanks for your time today.
My pleasure. Thanks for having me.